So what we're finding in the UK is that generally people are supportive of immunization. One of the things that we really try and work on is making sure that immunizations are accessible. And there are a few people who are really not going to have the vaccines under any circumstance. Some people will need appointments that work for them, fitting it around if you're, trying to hold on your full-time job whilst being heavily pregnant and trying to find time to get to vaccination appointments. Things need to be convenient for people. So that's one of the key findings. And some people need a little bit more assurance around both the need for the vaccine and the safety of the vaccine. And that's something that a lot of our health professions are really focused on. I think this study really can support that understanding of just what a positive impact the vaccine can have in preventing RSV as a very serious, very common cause of chest infections. Where, it doesn't have the same, people aren't as familiar with RSV as they are with flu, and they're not as familiar with RSV as they are whooping cough, and even the kind of the non-virus word that we use for bronchiolitis. I mean, it's not exactly one that trips off the tongue, and it's not exactly something that's known to parents. So there are lots of things about how we can think about this as health professionals, about how we frame this for parents. I think understanding that it causes chest infections, that it's common, that it can be very, very severe, and supporting parents to be thinking about what they would do in the circumstances as well. That should their baby be getting sick with those sorts of symptoms as well, are all things that health professionals can be thinking about. But really, this study does show huge benefits of RSV vaccination. We're living in such a wonderful time in terms of medical science. There have been huge breakthroughs in RSV over the last 10 to 15 years that now mean that clinical practice is being transformed by the availability of immunization against RSV to keep babies safe. And there's some huge opportunities around the world. In high-income countries, certainly RSV does still cause deaths. Many more deaths are avoided by the existence of really great medical care already. But the opportunities from RSV maternal vaccination are huge in low and middle income countries. There is such opportunities with RSV vaccination. We're really glad to be able to share some results that show just how well maternal vaccine works against RSV in infants. So with being able to analyze at really large scale, we were also able to look at vaccination happening not that far before birth. So we knew from some of the immunology studies around the key clinical trial that you were starting to see some immunological protection reasonably soon after, and we know from other vaccines that it's not necessarily a 14 days cutoff. So that, which is our typical analytical window. So we actually specified that we were going to have a look at vaccines given 10 to 13 days before the birth happened, and even with a 10 to 13 day window, there's enough antibody transfer happening that we're still seeing around a 50% reduction in hospitalizations for babies born with that sort of window before for vaccination until they're born. So that for us is really promising, that while we say give as early as you possibly can in the approved vaccination window, that giving late into term, if that hasn't happened, is still a good option to try and get some protection into baby. We're really delighted to be able to share findings from England that maternal vaccination against RSV has very high levels of effectiveness against infant RSV for the newborn babies, the most vulnerable, for preterm babies where there's a long enough gap, 2 weeks or more between vaccination and birth. This is a really good option, a really useful tool for preventing RSV bronchiolitis, and really hope that RSV vaccination can be an important tool for driving down those admission rates that we see for RSV, and keeping babies safe and providing great peace of mind for parents, I hope.